The bicep brachii is a large, thick muscle on the front of the upper arm. It provides flexion and supination of the forearm. There are two main parts, the short head and the long head, which are indicated as red and blue in the picture shown below. The short head of the bicep is located on the medial side. This controls the adduction of the arm, pulling the arm towards the body. The long head is on the lateral side and controls the abduction of the arm, pulling the arm away from the body. This image signifies the movement of the arm through arrows pointing the direction of the muscle. The GIF shown gives a good representation of how the picture's arrows control how the arm moves. The view gives a clear idea of what muscles we are activating with the exercise coming up. A common bodyweight exercise that activates the movement of the bicep brachii is the well-known chin-up. As you can see, this exercise uses the biceps to descend the body down and pull it back up by the flexion of the muscle, but it also includes other muscle groups due to the stabilization of the body. Here we performed multiple repetitions to show how the exercise is done to train the muscle group. A free weight exercise added to many routines to build the bicep brachii is the dumbbell curl. This exercise uses mainly the bicep brachii due to being steady on the ground and using much of the force from flexing the bicep. A few repetitions are shown to show the motion of the arm. Machine exercises are used to put less strain on the body to better perform the exercise for the muscle group being targeted. For the bicep, a modified bicep curl can be done on a machine to ensure the bicep brachii is flexing to its full potential. Here, we showed repetitions to show the difference between body weight and machine dumbbell curls. Triceps brachii are large, thick muscles on the back of our upper arms, specifically the posterior surface of the olecranon process of the ulna, capsule of the elbow, and antebrachial fascia. The muscle has three parts named the long, lateral, and medial head. The long head originates from the infraglynoid tubercle of the scapula on the back of the humerus bone. The lateral head originates on the posterior surface of the humerus, and the medial head from the dorsal humerus below the radial groove. The image shows arrows to signify the way the tricep brachii and bicep brachii move opposite each other in order for the arm to be able to pick up weight and put it down. The action of the triceps is primarily to extend the elbow and work antagonistically of the biceps. The image shows how the tricep brachii is fully contracted when it is being flexed by pushing the arm downwards. While looking at this short clip, notice that the red muscles show both the bicep brachii in front and the tricep brachii in the back. The bodyweight exercise that clearly shows the movement of the triceps are diamond push-ups. This exercise utilizes the stabilization of the body to put pressure on the triceps due to the position of the hands. The hand position gives the body the opportunity to extend the triceps by pushing up the body from the arms being closer to the center of the chest. Standing overhead dumbbell tricep extensions allow you to emphasize the work your triceps are putting in by keeping your body upright with the use of a dumbbell or free weight. It creates the extension of the triceps by pulling the dumbbell over your head and locking the elbows to get the full use of the tricep. A machine exercise to extend the tricep muscle would include cable rope tricep extensions. This exercise is the same movement as the overhead dumbbell press, except the rope is being pulled down through abduction. Due to this being similar, another machine exercise that can also be a bodyweight exercise to stimulate the use of the tricep includes assisted dips. This can be done by using a bench for bodyweight exercise, as shown, or some gyms offer machines that can reduce the amount of body weight you are pushing up. Any form of dip flexes the tricep brachii by pushing the body upwards. The deltoid, also known as the shoulder muscle, is one muscle with 3 separate areas. It contains one insertion in which the deltoid is at the nodule of the humerus. It extends, laterally rotates, and transversely abducts the arm at the shoulder joint with an origin at the spine of the scapula. The drawn image places arrows in the way each part of the deltoid moves when the shoulder is abducted. It shows how the shoulder muscles are contracting toward the body in order to move the arm away from the body. The image shown gives a good representation of how the arm moves in order to activate the use of the deltoid muscle. It gives us a darkened red area to show the muscle we are focusing on. A bodyweight exercise that uses the deltoid is a plank with shoulder taps. This exercise works all 3 areas of the shoulder by stabilizing the body under the shoulders and hips. Most of the time, this exercise is under time intervals to make sure the deltoid muscle is getting trained properly. Lateral raises are a free weight exercise that works the lateral part of the deltoid by abducting the arms out to the sides of the body. Any type of dumbbell raises can be altered to hit different parts of the deltoid for an overall shoulder workout. The overhead press exercise is a machine exercise that works the front deltoid by pushing weight over the head. This exercise can be done with free weights as well, but the machine exercise produces a more stable use to get the best results for an athlete's form. Also, the lateral deltoid can be involved by stabilizing the body to keep the weight in line of the body.